Hi, we're lucky enough to be joined today with or by Dr. Richard Faris, who's the Chief Growth and Strategy Officer at Panther Rare. Richard, thank you so much for your time and your willingness to share some of your expertise and knowledge with our audience. So, if you would you give us a bit of a background of how you came to be in the role you're at with Panther and kind of your career path, if you will?
Yeah, thanks, John. I appreciate the opportunity to be here today.
Great.
Yeah, I'm a pharmacist by training, obviously. So kind of been in this industry now for over 3 decades. It's hard to believe, but I've been able to touch a lot of different areas. I also do have a PhD in the pharmacoeconomics, health outcomes
Nice.
area. So I have done a lot of work there in the past. I started out in health system pharmacy and really progressed in various ways there, leading a health system pharmacy at a university teaching hospital, as well as
Mhm.
I've spent time inside the pharmaceutical industry. I've spent time as a full-time professor at the University of Tennessee, as well as getting into specialty pharmacy a little over 15, actually it's almost 20 years now.
Oh, wow. Yeah. Yeah.
So it's yeah, been a little bit inside of that industry. And
Hmm.
I came here to Panther about 6.5 years ago, and really as a rare disease pharmacy, Panther really was focused on the specialty drugs where they deal with very small patient populations typically and a little bit more complex therapies. And at
Okay.
Panther, we really do focus on either what's called exclusive, where we're the only pharmacy that
Okay.
has access to the drugs to be able to dispense them, or as we've defined, highly limited, which is 4 or less pharmacies in the network. So really focused then on the patients, the very vulnerable population of the rare
Okay.
disease pharmacy.
Wow. Yeah. That really, when you get into it, it's you find out there's so many different disease states that and therapies that are focused on folks that this is the only way that they've got any hope for a future, right? So it
Right.
really, the patient is always sitting at the center of everything that you're doing at Panther, right?
Correct. Yeah, and you're right to point out the number of rare diseases, because while rare diseases have been defined as somewhere under 200,000. We obviously see a lot of them that are 500 patients or
Yeah.
less. There's 7,000 rare diseases.
Oh my
It
gosh.
probably, yeah, 93% of them do not have an FDA approved treatment. So there's a huge
Whoa.
unmet need in there. And so even though these populations can be small, there's a big unmet need. But if you added all the 7,000 populations up, the estimate is
Mhm.
that it would equal the number of people who have diabetes in the U.S. So it's not small.
Oh my gosh. Wow. That's a I mean, unfortunately that's a huge number, right? And growing, which is I'm sure the case in the rare disease side of it. Wow.
Yes.
Wow. That's something that's given me pause to think about because there's so many disease states out there, but with what 93% without any type of therapy. Wow. So
Correct.
there's a huge opportunity out there to help more and more patients, right? And as you said, it's unfortunately probably growing maybe not as highly or quickly as the diabetics population, but there's still a pretty large growth in those populations over time, I bet. So well, with
Mhm.
that background, and obviously, with your background as a pharmacist and as a professor, what's one thing that we're doing now currently in the practice that you'd like to see us stop to kind of move pharmacy forward?
Yeah, I'll tell you the stop part of me in the world of pharmacy, and it really is a broader healthcare issue. Is we really have
Yep.
to, I think, stop racing to the bottom in terms of focusing on lowest cost
Okay.
and particularly lowest unit cost.
Hmm.
Because as you know, with pharmacy, we're typically reimbursed based on the cost of the product and not necessarily always
Hmm.
reimbursed for the services that we provide. And as you talk about being patient centric, in some way, shape, or form, we need to be reimbursed for the very valuable services that pharmacists and pharmacies provide to
Yes.
these patients. And we need to be thinking about them and their entire care. So I
Yeah.
think we need to stop that. I mean, I understand why we're focused on cost in some places, but as we look across pharmacy, we know a lot of, especially the corner drugstores, the independent pharmacies, and even some of the bigger chains are really struggling these days.
They
And
are. Yeah.
there's an alarming trend in the reimbursement. So it just focuses on dispense more, dispense more, dispense more, not cost.
Right. Right. Yeah, and that's a great point. I think if as you start to think about everything that we do in pharmacy to help patients, it isn't just getting that medication in the patient's hands, which obviously is core to what we do, but really being able to kind of separate
Mhm.
the care from the cost, right, if you will. So that's a great point. So I'm glad you brought that up. So knowing that there's that aspect of it, what's something we should start doing more to help us become more, kind of proactive and better the practice of pharmacy across all the industries.
Yeah, and I love the practice of pharmacy as you meant, or I said earlier, and you mentioned I've been a
Yep.
professor. I've trained a lot of pharmacists. My wife is
Hmm.
even a pharmacist.
Oh,
But
cool.
I just think as pharmacists too, sometimes we have to take off that white lab coat
Yep.
and we need to start thinking about patients as people. It's really
Yeah.
easy to use that word patient and it sort of
Hmm.
puts them in a box, but really thinking about them outside of even how they use medications. Because if we think about why they would take medications and it gets to the adherence side of things,
Hmm.
that people take medications not for the therapeutic objective that we've all been trained on, and that physicians
Right.
prescribe it for a specific therapeutic objective, but rather start to understand that that person on the other end, they have hopes and aspirations. They have moments in life that they want to experience. And how do we tie the
Hmm.
medication taking behavior with them experiencing those moments in life that are most important to them? So I think
Right.
starting to think about them and putting ourselves on the other end and maybe not having that white lab coat on and always want to talk about the clinical stuff, and trying to understand what that person is going through because they're active participants in the care process.
Right.
And really need to partner with them more as opposed to thinking that, well, I've got information that I'll share with you, and then
Hmm.
it's up to you to take my clinical information I've just given to you and apply it to your life because that doesn't really work. And we know we've got a huge adherence problem. So I think
Right.
stop using the word patient, start using the word person.
Yeah, I love that aspect of it because it does think about, the whole person and, their mothers, fathers, brothers, sisters, people, right, that have loved ones and friends and things they want to aspire to. And it does make a mindset change. And really, I think we get caught up and we're so good at the clinical aspect of it. We want to make sure that people understand what they're doing. Maybe we need to use more tools that help drive education for people, so they understand why they're taking these meds. And frankly, that helps us understand why they're taking these medications too, to your point of not
Yeah.
just why, but also the who, right? So, and then there's so much pressure on pharmacies to process, as many scripts as possible per hour. And, that's the whole thing of you've got to get your metrics down. You talked about stopping the unit cost, right? So maybe we stop using the metric of scripts per hour, right? But it's the tough thing is these are easy to do, right? Easy to measure rather than the kind of the qualitative aspects, which is what you're talking about with that, kind of thinking of them as people. So being able to provide tools, like medical memory is a great tool that helps people understand why they're taking their medication, excuse me, they educate them on the medication, and then I think that would help the pharmacist, kind of focus on the people, right? So I'll send all the information, clinical and everything else, but let's talk about why you're on this and how's it gonna impact your lifestyle. So I love that
Right.
aspect of it.
Mhm.
So with the background, and you touched on this earlier too, with so many every day there's a headline of something PBMs or pharmacies closing and independents shrinking and reimbursements are going away. So what's something right now that we're doing that you think we need to continue to do to push practice forward?
Yeah, and the beautiful part about pharmacy is we really are at the intersection of kind of that other side where the
Hmm.
physicians, health systems, IDNs, and then a person being in the home and caring for themselves.
Yeah.
And
Yeah.
so I think we have to continue to work to reduce barriers, improve access. Affordability is certainly an issue, but then as you just mentioned too, the understanding of the medications that
Yeah.
people so desperately need. We're,
Right.
the healthcare system is so complicated and so chaotic and so fragmented.
Yeah.
And as pharmacists, I think we've always, really prided ourselves on kind of being that neighborhood person, that neighborhood healthcare provider. And
Hmm.
I love that part of pharmacy. So let's continue to do it.
Absolutely.
continue to serve those people that are most vulnerable in our society, and trying to help them, because the barriers are what the issues are, and we all deal with it, whether it's insurance and prior
Mm-hmm.
authorizations and things like that. How do we shield that, that person from some of those barriers, and really we're seen more as a partner with them, not another barrier in the system.
That's a great point, right? And that is you think about, you see the pharmacy more often than anybody else, typically in the healthcare community, right? And so,
Mm-hmm.
we want to be that person that's helping the people that are coming to our pharmacy to find out. I mean, I know that's always my first call whenever there's a medication. I call. I'm lucky enough to know lots of pharmacists that are great people and always willing to help. I ask their opinion, and to your point about, let's start thinking about how this impacts lifestyle for people. And so that's really the goal of when I talk to my pharmacist friends, of how's this going to impact my life, or if my kids are on some new medication, that's even more important. If because I feel like I've made my choices in my life, right? And so, but I want to make sure that my kids are getting the best care that they can get. So I really appreciate the time. Anything else that you want to add in that maybe, that kind of help the pharmacy, with your background and your knowledge? It's great to share your insights with our audience. So I appreciate that.
Yeah. No, and I appreciate the time here too, John. It's been great to talk with you
Yep.
and go through these. I'm such a huge proponent of what pharmacy can
Yeah.
do, and really
Yeah.
helping people to live better lives. Let's just keep
Yeah.
doing it.
Absolutely. You're a great advocate for the practice, and we appreciate the time, Richard, and we'll talk again soon. Thank you.
All right. Sounds good. Thank you.